So now we're going to discuss about the vessels of upper limb. Now we're going to draw the line diagram first. So now this is our subclavian artery. Now the subclavian artery, yes, it is divided into three parts by one muscle. That is our scalenus anterior muscle. So scalenus anterior muscle divide the subclavian artery into three parts. Subclavian artery already we discussed in the brain and head and neck topic. Now this is the first part of subclavian artery, the second part, and this is the third part. Now what is the name of the muscle? Scalenus anterior muscle. Yes. Now this is our first rib. Now outer border of first rib. Up to that is the extension of our subclavian artery. So from the outer border of first rib, the subclavian artery continue as axillary artery. So this is our axillary artery. Yes. So that is our axillary artery. So axillary artery extends up to the lower border of teres major muscle. The teres major muscle is here. So this is our teres major muscle. So the subclavian artery extending up to the outer border of first rib. Now from the outer border of first rib, axillary artery, which extend up to the lower border of teres major. At the lower border of teres major muscle, the axillary artery, which in turn continue as brachial artery. So this is our brachial artery. So brachial artery, continuation of axillary artery from the lower border of teres major muscle up to the level of neck of radius. At the level of neck of radius bone. At the level of neck of radius bone, the brachial artery divide into two terminal branches. What are those? Our radial artery and ulnar artery. Okay, so this is radial and ulnar. Right. So by this line diagram, we come to know the extension of each arteries. Okay, right. So what is the extension of axillary artery? Axillary artery extending from the outer border of first rib to the lower border of teres major muscle. Brachial artery from the lower border of teres major muscle up to the neck of radius bone. So we're going to write the extension. So axillary artery extends from the outer border of first rib, outer border of the first rib to the lower border of teres major muscle. Lower border of teres major. Now brachial artery extending from the lower border of teres major up to the level of neck of radius bone. At the level of neck of radius bone, the brachial artery divided into two terminal branches, radial artery and ulnar artery. Okay, so radial artery and ulnar artery, they supply the forearm. Okay, so all the forearm muscles, they are supplied by radial artery and the ulnar artery, and they also supply the palm. How, sir? By forming arches. So in the palm we have superficial and deep palmar arch. We see the palmar arches later. Okay, right. So ulnar artery and the radial artery, they supply the forearm and palm. Right. So this is about one overview of the vessels supplying the upper limb. So now we're going to discuss in detail about the axillary artery. Like subclavian artery, axillary artery also divided into three parts by one muscle, that is our pectoralis minor muscle. So this is our pectoralis minor. So pectoralis minor dividing the axillary artery into three parts. Now this is the first part of axillary artery, and this is the second part of axillary artery, and this is the third part of axillary artery. Right. Now what are the branches coming from first part, second part and third part? Now see the diagram. Right. So in the diagram, yes, we are seeing the axillary artery. I told you the extension from the outer border of, this is first rib, up to the lower border of teres major muscle. Now we are seeing pectoralis minor muscle dividing the axillary artery into three parts. One, the second part is behind the muscle, and the third part. Okay. Right. Now what are the branches? Now branches from the first part, second part and third part. Now branches. The first part we give only one branch. Second part 2 branch. Third part 3 branch. Now branches from the first part. Okay, so first part gives only one branch, that is our superior thoracic artery. Superior thoracic artery. Okay, this one. Next, the second part. The second part give two branches. Okay, now this one is the thoracoacromial artery, and this one is the lateral thoracic artery. Okay, second part gives thoracoacromial artery and lateral thoracic artery. Right. Now, third part. Third part give three branches. What are those? Subscapular artery, okay, and two circumflex artery in the front side and the back side. Anterior circumflex humeral and posterior circumflex humeral. They wind around the humerus bone. Okay, so they are called circumflex arteries. So third part give three branches. Subscapular artery, number 2 anterior, number 3 posterior circumflex artery. Okay, circumflex humeral artery. So we have three branches from the third part. Now the subscapular artery, which in turn gives circumflex scapular artery. So circumflex scapular artery is the branch of subscapular artery. Okay, now subscapular artery, after giving the circumflex scapular, which in turn continue as thoracodorsal artery. So thoracodorsal artery is nothing but continuation of subscapular artery. Right. Next, thoracoacromial artery. See, thoracoacromial artery gives four branch. Now mnemonic is A, P, C, D, not A, B, C, D. A, P, C, D. Okay. So thoracoacromial artery gives four branch. What is A? A is acromial branch. P is pectoral branch. C is clavicular branch. And D is deltoid branch. Okay. Right. So four branches given by thoracoacromial artery. So these are all the branches from the axillary artery. Right. So I told you already, subclavian artery, continuous axillary artery. Axillary artery, continuous brachial artery. Brachial artery supply the arm, and brachial artery divided into radial artery, ulnar artery, supplying the forearm and palm. So now the patient is having block. Where, sir? At the beginning of the axillary artery. He is having block at the beginning of axillary artery itself. So now what happened to the patient? The entire blood supply to the upper limb is maintained or not? Blood supply is maintained. So though we have a block at the beginning of axillary artery, the blood supply to the upper limb is maintained. How, sir? By anastomosis between the subclavian artery and the axillary artery. And this anastomosis is taking place around the scapula bone. So this anastomosis is called scapular anastomosis. So please write scapular anastomosis. We're going to discuss about the scapular anastomosis. So scapular anastomosis, it is between subclavian artery, between the branches of subclavian artery and axillary artery. Okay, this scapular anastomosis maintains the blood supply to the entire upper limb, even the patient, if the patient is having block at the beginning of axillary artery. Okay, right. So scapular anastomosis maintains the blood supply to the upper limb even if the patient is having block at the beginning of axillary artery. Now this anastomosis is taking place in three regions. Okay, see the diagram. Now anastomosis, it is taking place over here, number 1, number 2 here, and number 3 here. So in three areas the anastomosis is taking place. So number 1, inferior angle. Number 2, over the body of scapula. Number 3, over the acromion process. The anastomosis over the acromion process, it is the minor anastomosis. Okay, right. Now what are the vessels involved? Okay, in the exams they ask you specifically what are the vessels involved in the anastomosis over the inferior angle of scapula, over the body of the scapula, or the acromion process. Likewise, you get the question specifically. Right. Now we see one by one. Now first we're going to discuss the anastomosis at the inferior angle. See here. So we're going to zoom this diagram and we're going to see the arteries. So now we're going to discuss the arteries involved in the anastomosis at the inferior angle of the scapula. Now see the diagram. Now two vessels involved. What are those? One branch is coming from here. Now I'm going to mark this artery as A and another branch. So these two arteries, they're anastomosing. So what is A? So A is our dorsal scapular artery. Okay. And B is our subscapular artery. So dorsal scapular and the subscapular, they anastomose with each other at the inferior angle. So what are the arteries? Dorsal scapular artery. Anastomosing with subscapular artery. Okay. Right. Now dorsal scapular artery is a branch of, very good, third part of subclavian. Third part of subclavian artery. Right. What about subscapular artery? Third part of axillary artery. Yes. So these two arteries involved in the anastomosis over the inferior angle. Fine. Next, anastomosis at the body of the scapula. Number 2. So number 2, anastomosis at the body of the scapula. Here 3 vessels involved. What are those? Right. Now 3 vessels involved. What are those? Now this vessel, can you see this vessel here? That is our dorsal scapular artery. I'm marking as A. And the subscapular artery is giving this branch that is winding around the scapula and giving contribution. So contribution from circumflex scapular. So we have one more contribution from suprascapular artery. So this one, see this branch. So 3 vessels are involved in the anastomosis over the body of the scapula. What are those? Dorsal scapular, suprascapular, and circumflex scapular. Okay, so we're going to write. So A, again, that is our dorsal scapular, and B, circumflex scapular, and C, suprascapular artery. Suprascapular artery. Fine. Next, so dorsal scapular artery, it is a branch from third part of subclavian. Just now I told you. Fine. Circumflex artery, branch of, very good, subscapular artery. Branch of subscapular artery. Now subscapular artery is a branch of, just now I told you, third part of axillary. Now suprascapular artery, it is not a direct branch from the subclavian artery. Okay, suprascapular artery is a branch of, I told you, the head and neck module itself. Yes, it is coming from, very good, thyrocervical trunk. Thyrocervical trunk, it is a branch of first part of subclavian. First part of subclavian gives 3 branches. Mnemonic, VAT branch, vertebral, internal thoracic, and thyrocervical trunk. So first part of subclavian artery, thyrocervical trunk. Okay. Now thyrocervical trunk gives 3 branches. I told you mnemonic. Mnemonic is SIT branch. So S is our suprascapular artery. I inferior thyroid. T transverse cervical. So suprascapular artery, branch of thyrocervical trunk, branch of first part of subclavian. So these are the vessels involved in the anastomosis over the body of scapula. 3 vessels: dorsal scapular, circumflex scapular, and suprascapular artery. Okay, right. So one last anastomosis over the acromion process. So third one, the anastomosis around the acromion process. I told you already, it is a minor anastomosis. Right. Now see the diagram. Now this is our clavicle and this is our acromion process. Okay. Right. Now 3 vessels involved. What are those? Now see this branch. Now this branch is coming from, yes, suprascapular artery. Suprascapular artery is giving the contribution. And see this branch. This branch is winding around the posterior part of the humerus, that is the posterior circumflex humeral, and is giving one branch, and that branch is ascending and coming to all the way to acromion process. And we have one more branch that is coming from thoracoacromial artery. I told you thoracoacromial artery gives 4 branches, mnemonic A, P, C, D. The acromial branch also giving contribution. So that branch we're not able to see here. I will show you in the front view. Now see the diagram. Now this is our thoracoacromial artery. So this is the thoracoacromial artery. So thoracoacromial artery is giving the acromion branch, this branch. See, that branch is coming to acromion process. Okay, so 3 vessels involved in the anastomosis over the acromion process. What are those? Now this is A, this is B, and this is C. So what is A, B, C? So A is the contribution from suprascapular artery. Suprascapular artery. B is contribution from posterior circumflex humeral, and C is acromion branch of thoracoacromial artery. Thoracoacromial artery. Okay, yes. So these are vessels involved in the anastomosis over the acromion process. So that's all about the anastomosis around the scapula. Okay, so scapular anastomosis, very important. They will ask you specifically what are the vessels involved. All the following vessels are involved except. Likewise, they frame the question. So we have anastomosis over the inferior angle, body, and the acromion process. Okay, right. So next, we're going to discuss about the brachial artery. Right. So next, we're going to discuss about brachial artery. Now, brachial artery extension from lower border of teres major muscle up to the neck of the radius bone. At the level of the neck of radius bone, the brachial artery is divided into 2 terminal divisions, ulnar artery and radial artery. Yes. Now see the diagram. Yes, this is our brachial artery. Now brachial artery is giving the terminal branch at the level of the neck of radius bone. That is the neck of radius bone into ulnar artery and radial artery. Next, branches. So what are the branches coming from the brachial artery? Number 1, profunda brachiae artery. Profunda brachiae artery. Number 2, ulnar collateral arteries. We have 2, superior and inferior ulnar collateral arteries. And we have 2 terminal branches, ulnar artery, radial artery, and the brachial artery also gives some muscular branches. Yes, these are the branches from the brachial artery. Okay, profunda brachiae, superior ulnar collateral, inferior ulnar collateral, radial artery, ulnar artery, and some muscular branches. Now, see the diagram. Now, the diagram, you see these branches. First, see the brachial artery. Yes, this is our brachial artery. Yes, the brachial artery is giving profunda brachiae artery. Okay, see the profunda brachiae artery, I told you already, that is a structure passing along with one nerve in the spiral groove, radial nerve. So profunda brachiae artery, see here, it is having the course. This is a spiral groove. Spiral groove, I'll mark here. This is a spiral groove. Now, along with the profunda brachiae artery, radial nerve is passing in the spiral groove. So, please write profunda brachiae artery accompany the radial nerve in the spiral groove. Accompany radial nerve in the spiral groove. Yes. Now, the profunda brachiae artery is giving radial collateral arteries. See the diagram. The profunda brachiae is giving this branch, that is our radial collateral artery. So sometimes the examiner want to give a tough question. In that they may ask these type of questions. Radial collateral artery. In the NICT exam you may get. Radial collateral artery, it is not the direct branch of brachial artery. Okay. Radial collateral arteries are the branch from profunda brachiae artery. Okay. So please write radial collateral arteries. So please put one box and then write radial collateral artery, radial collateral arteries are the branches from profunda brachiae. It is not the direct branch of brachial artery. Okay, fine. Next, ulnar artery and radial artery. Right. So ulnar artery and radial artery, I told you already, they supply the forearm and they also supply the palm by forming the arches, superficial and deep palmar arch. Right. So now we're going to discuss some applied. Now the patient is having one fracture. What fracture? Supracondylar fracture of the humerus. Now in the case of supracondylar fracture of the humerus, the most commonly affected nerve is our anterior interosseous nerve. So in the supracondylar fracture of the humerus, the most commonly affected nerve is anterior interosseous nerve, anterior interosseous nerve greater than median nerve. Yes, fine. Right. What about the artery? In the supracondylar fracture of the humerus, brachial artery is lacerated. Brachial artery is lacerated. So brachial artery lacerated means there is no radial artery, ulnar artery. So what happened to the forearm muscles? So just now I told you, radial artery, ulnar artery, they supply the forearm and palm. So all the forearm flexors, they are going for ischemic contracture, that is called Volkmann's ischemic contracture. So Volkmann's ischemic contracture is due to ischemic contracture of forearm flexors. Ischemic contracture of forearm flexors. Okay. So Volkmann's ischemic contracture is seen in our supracondylar fracture of the humerus due to brachial artery laceration. Fine. So that's all about the brachial artery. Just to know the branches and the applied, that is enough. Next, we're going to discuss about the radial artery, ulnar artery. So radial artery, ulnar artery, they are the terminal divisions of brachial. They are formed at the level of neck of radius. Fine. Now, certain important branches you have to remember. Now, see the ulnar artery. So ulnar artery is giving the common interosseous artery. So common interosseous artery is the branch of ulnar artery. Now this common interosseous divided into anterior interosseous and posterior interosseous artery. Clear? So please write by the side. Anterior and posterior interosseous artery. Interosseous artery or branch from common interosseous, and common interosseous, it is a branch of ulnar artery. Okay. What about the nerve? We have anterior interosseous nerve and the posterior interosseous nerve. No, anterior interosseous nerve is a branch of anterior interosseous nerve, branch of median nerve. Okay. What about the posterior interosseous nerve? Posterior interosseous nerve is the branch of radial nerve. Very good. Posterior interosseous nerve is the branch of radial nerve. So nerve, they have a different origin, different source. Artery, they have a common source. So anterior and the posterior interosseous artery, they are the branch of common interosseous, again in turn branch of ulnar artery. Okay. Now one more branch you have to remember, that is our recurrent interosseous artery. Now recurrent interosseous artery, it is coming from posterior interosseous artery. Why they record anterior and posterior? Because they pass in front and behind the interosseous membrane. See the diagram. Now this is our radius bone and this is our ulnar bone. So this is our common interosseous artery. That is our common interosseous. Now the common interosseous divided into anterior interosseous artery and the posterior interosseous artery, because one is passing in front of interosseous membrane and other one is passing behind the membrane. Now one more detail you are seeing in this image. Now the interosseous membrane between the radius and the ulnar bone is pierced by one structure. Only one structure piercing the interosseous membrane. What is that? Our anterior interosseous artery. So the only structure which pierces interosseous membrane. So interosseous membrane is pierced by our anterior interosseous artery. Anterior interosseous artery. Very old PG entrance question, NEET exam question. Okay, right. I told you in the extensor retinaculum topic itself, the interosseous membrane is pierced by anterior interosseous artery. After piercing the artery, anterior interosseous artery, passing in which compartment of the retinaculum? Fourth compartment of the extensor retinaculum. So anterior interosseous artery, after piercing the interosseous membrane, which pass in the fourth compartment of extensor retinaculum. So I hope you remember. Already we discussed about the fourth compartment in the extensor retinaculum topic, right? So now see the diagram. Now after supplying the forearm, the radial artery and the ulnar artery, they come to hand, and in the palm they form arches. So now we're going to discuss about the palmar arches. Palmar arches, two in number, superficial palmar arch and deep palmar arch. Now see the diagram. Yes, in this we are seeing superficial and deep palmar arch. Now, superficial palmar arch is a direct continuation of ulnar artery. Yes, this is ulnar artery, medial side, lateral side. So, ulnar artery, yes, which continue as superficial palmar arch. Fine. Now, the superficial palmar arch completed on the other side. See, this is the superficial palmar arch, which is completed on the other side by one small contribution from the radial artery. This is a contribution from radial artery. So, for each arch, we have major contribution and minor contribution. So, superficial palmar arch, major contribution by ulnar artery, minor contribution by the radial artery. So, ulnar artery, which continue directly as superficial palmar arch. Right. Next, we're going to see deep palmar arch. So, deep palmar arch is a direct continuation of radial artery. So, this is the deep palmar arch. Can you see here? Yes. The deep palmar arch completed on the other side by one small contribution from ulnar artery. This one, contribution from ulnar. Okay. So, deep palmar arch, major contribution, radial artery, minor contribution, ulnar artery. So, first we write here. Now, superficial palmar arch, major contribution by ulnar artery. And the arch is completed on the other side by one small contribution from radial artery. Now, what about the deep palmar arch? Deep palmar arch is a direct continuation of radial artery and minor contribution from ulnar artery. Fine. The point is, for each arch, superficial and deep, both arteries are involved. Now, why we have this arrangement, sir? See, if there is block in any of these artery, radial artery, ulnar artery, the other artery maintain the blood supply. Suppose your patient is having a block in the ulnar artery. Now, the radial artery maintains the deep palmar arch, and through minor contribution, the radial artery also maintains the superficial palmar arch. So, even if there is a block in any of these arteries, the other artery maintains the blood supply. Okay, that is why we have this arrangement. Now, one more point. Now, sometimes they ask you which arch is proximal, which arch is distal. See, our deep palmar arch, this is proximal and this is distal. So, which arch is proximal? Yes, our deep palmar arch is proximal and the superficial arch is distal. So, one more point, sometimes they may give you, so deep palmar arch located distally when compared to deep arch. So, deep palmar arch is proximally located. Okay, right. Now, see the diagram. Now, in the diagram, yes, we are seeing some branches. Now, so one more point about the arches. Now, sometimes they may ask you which arch is proximal, which arch is distal. They may give you the true or false statement. Okay. Now, see the diagram. Now, in the diagram, this is the deep palmar arch and this is superficial palmar arch, which is proximal. Deep palmar arch is proximal. Okay. And the superficial palmar arch is distal. Fine. Now, the patient is having block in any of these artery, radial or ulnar. Then how to identify the patency? By doing one simple test called Allen test. So please write Allen test to check the patency of radial artery or ulnar artery. To check the patency of radial artery or ulnar artery. Now, this test is very simple. Now, first step, we're asking the patient to make a fist. Second, we're going to give pressure on both sides of the wrist. By doing this, we are blocking both radial artery and the ulnar artery. So now, third, the palm will become pale. Now, in the fourth step, we're going to release the pressure on any one side. If that side of the artery is patent, then the palm will become normal pink color. Now, in this diagram, we are releasing the pressure on the medial side. So, if ulnar artery is normal, ulnar artery maintains the superficial arch. Ulnar artery, by giving one small contribution, also maintains the deep arch. And we're going to repeat the test for the other side, for lateral side, radial artery. Okay, right. So this is about the Allen test. So Allen test, in the recent exam, they gave video based question. 2019 AIMS exam, they gave video based question. Okay, they gave Allen test. So Allen test to check the patency of radial ulnar artery. So now we're going to see some animations for the vessels of upper limb. Right. Now in this we are seeing the axillary artery. So axillary artery, continuation of the third part of subclavian artery. Now axillary artery, we know three parts. The first part gives only one branch, that is our superior thoracic artery. First part branch. Second part gives two branch. Now this is thoracoacromial artery, and just below that lateral thoracic artery. Second part, two branch. Now third part give three branch. Number one, subscapular artery. Okay. Now subscapular artery is giving one branch. That branch wind around the scapula bone, and that branch is called circumflex scapular artery. Circumflex scapular, which is winding around the scapula. Now two more branches given by the third part of axillary that wind around the humerus bone in the front side and back side, anterior circumflex humeral and posterior circumflex humeral. So now these are the arteries, branches from the third part of the axillary artery. Right. Now we're going to see the anastomosis between the axillary artery and the subclavian artery. Now this anastomosis is happening around three regions: over the inferior angle of the scapula, over the body of the scapula, and minor anastomosis over the acromion process. See, the main arteries involved in the anastomosis are the dorsal scapular artery, branch of third part of subclavian, dorsal scapular, and suprascapular artery, branch of thyrocervical trunk, SAT branch, and circumflex scapular artery and subscapular artery, the branches of our third part of axillary artery. Okay, these are the main arteries involved in the anastomosis. Okay, I told you anastomosis taking place over three regions: over the inferior angle, over the body, and over the acromion process. Arteries already discussed in detail in the arteries module, theory module. You can refer the arteries involved in these parts. Okay, right. Now next we're going to see the brachial artery. Brachial artery is nothing but the continuation of the axillary artery. See here, that is the brachial artery, continuation of axillary artery. Now the brachial artery is giving one branch. There is a deep branch called profunda brachii artery. Can you see here? The profunda brachii artery also close to humerus bone, passing in the spiral groove along with the radial nerve, profunda brachii artery. Okay. Now the profunda brachii artery, yes, branch of brachial. Now the brachial artery at the level of neck of radius, dividing into two terminal branch, ulnar artery, and that is our radial artery. Okay. Now one more branch I want to show you from the ulnar artery, that is our common interosseous artery. I told you, common interosseous artery, branch of ulnar artery. Yes. Now the common interosseous artery divided into anterior interosseous artery and posterior interosseous artery. Yes, that is a common interosseous artery giving anterior interosseous artery and posterior interosseous artery. Can you see the branch here? Posterior interosseous artery. Okay. Right. Now the anterior interosseous artery piercing the interosseous membrane. Right. Now we're going to see the radial artery, ulnar artery. They form the palmar arches. I told you, no? Yes. Now in the palm, yes, we see the palmar arches, that is the ulnar artery passing above the flexor retinaculum band, and the ulnar artery forms superficial palmar arch. Superficial palmar arch on the other side, which is completed by one small contribution from the radial artery. A small contribution from the radial artery for the superficial palmar arch. Okay, right. Now the radial artery gives a branch to thumb, one full branch to thumb, that is atria principus pollicis, the principal artery to the thumb, principus pollicis artery. And radial artery also gives to the index finger, radial side index finger, that branch is called radialis indicis. Now after giving this branch, the radial artery continue as deep palmar arch. So deep palmar arch, continuation of radial artery, which is completed on the other side by small contribution from ulnar artery. Okay. So these are the palmar arches, deep palmar arch and the superficial palmar arch. Now see the animation here. Now, which arch is proximal? Very simple. Deep arch is proximal. Superficial palmar arch is just distal to the deep arch. So, deep arch is proximal to the superficial palmar arch. Okay. So, that's all about the vessels of upper limb.